The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center and Studio Arts and Glass. And, of course, with us today is producer J.D. DeAngelis. In the studio with me is Brad White, a compounding pharmacist. And joining us, no, we're not, in the studio with us also, is Dr. Ahmed Sabeh, Executive Director of Mercy Heart Center. We're very pleased to have Dr. Sabeh. Welcome back. He was on our first show 11 years ago. And we're looking very forward to talking today. Thanks for joining us this morning.
Thank you. Thank you for having me.
All right, about 2.5% of the U.S. population has valvular heart disease, but it's more common in older adults. Valvular heart disease is when any valve in the heart is damaged or diseased. There are several causes of valve disease. This morning we're going to talk with Dr. Sabeh about the causes, the symptoms, the treatments of valvular heart disease. We'd like to remind our listeners that our program is available on our podcast. You can look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app and take any of our programs with you anytime. If you have any questions you'd like addressed today, you can post them up on our live Facebook feed.
So, Dr. Sabeh, can you tell us a little bit more about yourself? I know you're famous in this medical community, but we really need to get a review. Okay.
Well, I'm a physician. My specialty is cardiologist, and the subspecialty is intervention cardiology. Means I do procedures inside the heart and the coronary arteries. I start my life. I finished my training in my general in Harvard, and it was natural to join academic institution. So I joined Penn State University, and I was in teaching for a few years. I was directing intervention cardiology for the university, teaching young doctors how to put stents and open the valves and the stuff. And then, like 25 years ago, I left academia and I came to this wonderful community. And I've been here since then.
Cool. So tell the listeners about the Heart Hospital at Mercy Medical Center.
Let me go back in time, because it was a matter of just changing the name, but years ago, more than 20 years ago, the idea of having a service line for the heart within the hospital came about. And it was quite unusual for a community hospital to have a physician executive. And I am not sure till today they have any physician executive. So this was a change into a community hospital. But I took charges of the heart service line as a physician executive. I did not stop practicing because I love intervention cardiology, and that's what really I feel the best. But seriously, in order to serve the patient the best, you have to take care of the caregivers. You have to take care of the nurse and the technicians and the doctors. And, of course, the facility around you, the equipment, the technology. It's not a matter of just a patient come to the hospital and a doctor great, you expect a great outcome. So it's a part of the teamwork. That's the beauty of the service we give the patient in the hospital is a teamwork. Every person is important. And it was really challenging, but it was quite interesting because I can throw one example. I don't know if the executive non-physician will like this, but it's so common. Every few years, in organization, whatever big, small, they come and they say, we're doing good, but we need to down the number of our people. The people could be doing a great job, and they come to you with a nice letter or thank you for your service, but it's like layoff. They have different names for this. And that's, to me, good for business, but for trust, I need the trust and the commitment of the people who work for me. And by the help of God, almost eliminated this from the service line of the heart for so many years. Many years ago, there was like a position have to be eliminated, and but around me, in the same institution, in every other institution, I see this happening all the time. And this make huge trust and the commitment. So we build you come to this service line and you see people who are really wants to help you. It doesn't mean that in other areas other than the heart we don't have this attitude, but there is people by nature, it doesn't matter, they serve the patient by all what they have. But the trust and the commitment to feel safe that you are going to, nothing will surprise you. And this was a great achievement I did. We started getting a new technology. We added what is new in the country. We put rules and regulations, and we committed to only proven beneficial procedures will be done to our patient. And there is just I saw the results a few days ago when I was presenting to our new partners, the Cleveland Clinic, the appropriate use criteria, like any procedure you do, it has to fill certain criteria. It should be done. We were almost 99% of our procedures met the criteria for appropriate use in our CAS lab. That's not the case because the national data in the table is very clear, far better than anybody. That is a kind of commitment. The patient will come, will trust us. I want him to go home, know what was done for him is really necessarily and needed to be done. To the best outcome. And that's where recently they decided to, how about we make it the heart hospital, because we've been practicing like an entity within entity, and that's where we are today, a teamwork.
How many doctors are in the heart?
We currently have 12 cardiovascular doctors into this, and an army of nurse practitioners and the assistants around them, and we are growing. So we are expected. We are recruiting more doctors to fill the demand.
So we're here today to talk about transcatheter aortic valve replacement, or TAVR for short, I guess. So, Doctor, what does the aortic valve do, and why is it so important?
Well, the aortic valve is one of 4 valves in the chamber of the heart. Of course, every valve is important, but this valve became very popular and famous because it affects quite reasonable number of patients, especially with the population getting older. So let me tell you what is this valve does. The largest chamber of the heart, which pumps the blood to get the oxygenated blood, which comes from the lung, to push it to your brain, to your heart, to your coronary arteries, to the heart, to the body, to the arms, to the stomach, to the guts. This is very strong chamber, the left ventricle, and when it squeezes hard, this semilunar soft valve just open, because it's like an umbrella. When the pressure go from below, it just open. When the valve open, the blood gush to all your body and feel good. You can function. When this valve harden, and it usually most common now is when you age. It can get faster if you have diabetes, hypertension, high cholesterol. But even if you didn't have any of this, after 75 years old, these cusps become calcific. Everybody get calcification, but when calcification extend into the cusps, opening, it gets hard. So the heart will squeeze, and the door to get the blood out doesn't open right away. Do you have symptoms with this? No, you don't. Why? Because the heart tries to do double the effort. So the muscle gets thick and stiffer to squeeze harder so you can get the blood out through the tough valve and feel okay. How about if you get the heart sick and you put the maximum? Do you start having symptoms? No. The atrium, the left atrium, started to dilate to get more blood to push it. So there is quite few years of mechanism when the heart try to figure out how can I push the blood through this tough calcific valve before you get symptoms. By the time you get symptoms, so many defense natural mechanism has been exhausted. And that's the key here. So when you start having symptoms with your aortic valve, the body already did a lot. And there is already demonstrated changes when they do the echo in your heart.
So that's how you determine a valve issue, and the echo?
We can determine this earlier before your symptoms if the doctor suspected, because once the valve narrow, I can, if I have my stethoscope with me today, I put it in any chest, I can tell you have a murmur. It's a very early sign, not symptoms. You have to listen to it. And when a doctor listens to the murmur, usually try to be ahead of the game and order echo or get you to cardiology, so we will be prepared or get early enough to interfere with this valve. If you are young, there's two other reasons actually can get you the valve to be narrow. One of them is congenital, because some people born with only 2 cusps, not 3, which is bicuspid aortic valve, and that can degenerate earlier, so they can get
cuspids being
2, the
flaps.
The leaflet.
Yeah, like a flower or something.
Exactly. I can't tell you if how I always think like the umbrella. The umbrella, when you open it, means the blood coming backward wants to get back to the heart. So the umbrella open. This valve stops the blood from getting back to the heart once it gets out. But when the heart squeeze, it closes this umbrella, but it's reversed. Like you get out, if the blood wants to come back, it closes it. So it's one-way valve. That's how, but the other reason is rheumatic fever, which is not, we don't see it often in this country anymore, but in different countries, rheumatic fever can cause aortic stenosis, not by calcification, by inflammation, so the leaflet will seal to each other. So it wouldn't open because it's sealed to each other, not because it's hard to move.
You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
Men like Paul White love Studio Arts and Glass. Why? We wrap all of his gifts. Gifts like hand-blown paperweights, ornaments, jewelry in stunning sterling silver and precious stones like amethyst and crystals. After 30 years, Studio Arts and Glass is known for creating and restoring stunning stained glass. Just ask Paul White. Studio Arts and Glass on Apple Grove and 77 in North Canton.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Dr. Sabe from Mercy's Heart Hospital.
All right, Doctor, you mentioned some of the causes for aortic valve to become damaged before our commercial break. For our listeners just joining us, could you just touch on that briefly again and how, you know, the heart works all the time. It doesn't get a break. It doesn't sound like the aortic valve's wearing out. It just sounds like it's getting worked hard, and just through the passage of time, it has these buildups of calcium. Is there other reasons for that?
Well, I cover this, but three major reasons for the aortic valve to get bad. One of them, when you born, congenital. So if you're born with abnormal valve, that's have a tendency to get bad faster, to get harder or calcific or stenosis or regurgitation. The second one is infection, and that's a rheumatic fever from streptococcus infection. The inflammation of the valve usually doesn't happen in the aortic alone. It always get mitral and aortic or mitral only, but I never saw it having aorta alone. So it is an infection when inflammation of the leaflet of the valve affected by the autoimmune process, and then later on it seals. So they don't open well. So they create the stenosis. The third one, which we've been talking about, it is aging process. Doesn't happen all the time. There's not like in every 10, maybe one, but it tends to be when the calcium when you is not working of the valve, it's just aging process. So above 75, this gets more pronounced, and we see the calcium sometimes on the valve affecting the base of the valve, but it doesn't come to the tips. So the valve is still moving okay. There is calcium, but no stenosis. and then calcium expand into the tip of the valve. Now the valve cannot move and get rigid, and that's when we get stenosis. There is a lot of study to try to find out is this process can be hindered or stopped. And they find out people who has diabetes has the tendency to have it more, people who has hypertension, high cholesterol. But there is no proof that if you control these risk factors, you will make this less. So, but it's all, it's something. Sometimes you are like 80 and why I have this? Well, I thank God I am 80. And when you were 50, you said if I guarantee you to be 80 and you get aortic stenosis, you will take it. But when you get 80, you start, why? Yeah. I don't know.
Wow.
So how about this? We had a question come in. One of the things before the break you mentioned that there really aren't a lot of symptoms, which kind of is a little freaky in this world. So one of the questions was, if you have high blood pressure, is that an indication that your heart's working harder to overcome? And kind of, you mentioned that the heart uses it and the body uses their defense mechanisms to overcome this problem.
Right.
So before you hear murmurs or some other things that lead, what do you hear before we realize we have a problem?
Well, the murmur, you can pick it up early before you have any symptoms.
And it doesn't mean you have this problem if you have a murmur too, right?
You have stenosis but mild.
Okay.
And we don't do anything for it.
Okay.
Before you have any symptoms, we don't do anything for you too. Because when you don't have symptoms, you have aortic stenosis, the heart is taking its mechanism, you're fine. And there is no proof. If you are fine with no symptoms whatsoever, I come change the valve, I will improve your anything.
Okay.
So it's naturally, once the symptoms start, we have to act.
Okay.
And that's really the key.
Okay.
Okay. Bottom of the hour, time for the news. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White from the Medicine Center Pharmacy. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacists can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
If you're worried about the flu and other viruses running around this winter, you need to check out our antiviral and antibacterial products we have in our Medicine Center pharmacies. We have hand sanitizer sprays for countertops, door handles, wipes, face masks, and many other items to help you stay well. It's also not too late to get a flu shot, as well as other immunizations. Plus, don't forget to take a daily multiple vitamin. Our pharmacists recommend Linus Pauling Super Multivitamins, so stop into Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
You're listening to Health Matters with the Medicine Center Pharmacy. Today we are talking with Dr. Ahmed Sabe from Mercy Heart Hospital. Got a lot more to cover this morning, so let's get back to the show.
All right, Dr. Sabe, can you take us through a patient's experience and what happens during a traditional aortic valve replacement surgery?
Let's go through this. A patient usually will get, he usually have symptoms. So I got chest pain or dizziness or short of breath. This is the major 3 symptoms when the valve really need to be dealt with. So hopefully my heart doctor knows about this. He knows that I had an echo a few years ago and knows that I have aortic stenosis, but I've been telling him I feel great until it started having the symptoms. So he will say, it's time for you to deal with this. First step, he will ask me, we need to do a heart cath. Well, doctor, I'm going for surgery and I accept the surgery. Why I have to do a heart cath? He say, it's simple, because the surgeon will open your chest to get to change, give you a new valve. And in your age, in your time, how about if you have some blockage in your coronaries? It's really funny to open chest to close it, and 6 months later you come with chest pain, having a heart attack. Makes sense, doctor. Thank you. I will take the heart cath. So we schedule him. He come to me, so we get to do the heart cath through his hand or his leg. And while during the heart cath, actually, we evaluate the lung pressure and the significance of aortic stenosis.
What can you see with a heart cath?
Well, the heart cath, you actually inject a dye to mix it with blood.
Okay.
And the radiation will show you where the dye goes. So if the dye go inside the coronary, you can see if the coronaries are open or they have blockages.
Okay.
And when you inject the dye inside the heart, you can see how strong is the heart squeezing.
I see.
And if you have a leaky valve, you can see the dye squeeze and go backward.
Okay.
But the dye will not help me with a stenotic valve, but the hemodynamics will, because I will get inside the chamber of the heart, see how high the pressure. And when the valve open, the pressure outside of the chamber should be the same. But if the valve is not open very well, the pressure inside the heart will be so high and the outside the body is low. So we can diagnose this too. So it is a procedure. When you get inside the chambers of the heart, you get inside the lung vasculature and see if the pressure in the lung high or not. Some people has short of breath. I don't know where is this coming from. We go find pulmonary hypertension. So that's what we get the information. We get back to the trip if I am a patient, and then they do the heart cath. Thank you very much. And the surgeon will come, look, yeah, you're lucky because I only have to change the valve. Your arteries were okay. You were a good patient. You did not smoke. You exercise every day. You eat the right food. Thanks God. So he tried to relieve me because I'm going for surgery. So he tried to give me a good news. That's empathy. We have the empathy in our heart hospital like crazy. That's how the emergency chest pain center is empathy. So we told, so I feel okay, but I'm still very, very scared and terrified. But the good doctor go to my family and tells them, he's so scared. I don't want you to scare him anymore. Just a smile in his face, reassure him. And that's really happening. I do that. So the family come, we're so glad you are here and you will feel great. And I tell them if there is future plans, like you are going to go somewhere in 6 months, talk about this. And so they put me in a very good spirit, if I believe what they tell me. And then you go to the OR that morning, and then anesthesia will come, they put to sleep. And I next time I wake up, I am in a bed. I don't know where I am. And there is so much tubes inside my neck and the chest tube and the stuff. But do a good job giving you pain medicine. You know, when you look at it, you usually will not remember much because the time your heart was down and chest open, you are sleeping. You don't separate the body from the conscious. So the time when I wake up, they tell me your valve is now open, you will feel better. And I wouldn't feel this right away because I have tubes and stuff. And then they tell me the valve is okay. It will be okay, but I have some pain from the healing and things. So it takes a time, few weeks, and maybe 4-6 weeks, I start really appreciating what the surgeon did for me, and I start to feeling good. Yes, the short of breath gone. I'm not dizzy anymore, and I don't have any chest pain. Although my arteries were good, but I was still having pain because of the valve was narrow. Sure. And then goes about a normal life span, you know, assuming you went through all of this with no complication. So 2 months later, you feel, appreciate what happened to you. That's if I am a surgical patient.
Okay, that's interesting. Interesting perspective, putting yourself in the.
I never did this, but you put me on the spot, so I try to do my best.
So, how long does a hospital stay with something like this, in a surgical event like this?
Oh, it could be 5 days.
Okay.
Yeah, it's sometimes they do minimal invasives. You don't crack the chest from the middle. On the side valve is minimum. And 3 to 5 days, if no complications.
Okay. So I understand they sort of get you up right away and make you walk or something?
Well, because the complications, the post-operative, need you to just move the patient fast.
Sure.
They try to extubate early. Like take the tube out of your lung and start. It's so painful to take a good deep breath, but they will give you pain medicine, so we don't want infection in the lung. Mm-hmm. We don't want any clots in the legs.
Yeah, sure.
Thrombus. So it's a revolution in the medicine in the last 20, 30 years. Open heart surgery is getting a lot better.
So we can replace all the valves in the heart?
You can, yes.
I mean, is it uncommon to replace many of the others, or other than the?
Well, aorta most common, mitral maybe second, and then down in the list is tricuspid. Okay. The pulmonary, they usually do some procedure, but it can also be replaced. But most common is. And it can be done surgically, of course.
Okay. So, you said 2 months, basically, for recovery?
It varies. If you are young, it gets faster. I'm talking about the aortic stenosis for elderly. If you are young, it goes a lot faster. Because young, healthy people, I wouldn't do the valve. I personally think, because surgeries, they give you a metallic valve which you can stay for 20, 30, it functions. Sure. So you go for one procedure. If you are in the middle risk or high risk, I think we have another option.
Okay, well, that leads me into my next question. So what would eliminate you from being a traditional candidate for a valve replacement that you just outlined?
Well, If you are too sick, the surgeon will not take you. If you have other comorbid condition, They usually use frailty test, like how far can you walk? You know, there is some people I can't do much, and despite he cannot do much, he still gets symptoms at rest because the valve. You know, I have an experience with patients who I said, I don't like my life the way it is. Yeah. She considered herself not alive. And she was probably one of the oldest I did. It was like 97.
Oh, wow.
And actually, they put her in our website because it was quite cool. And we fixed her valve, and next day she was home. And she's now talking, and the family are so appreciative. Now she's alive, you know, because life is not how many years you are alive, is how to enjoy it. And that's what's medicine about. I don't consider medicine to change how long you live. I don't believe in that. I think everybody has a day, and God will call for him. Huh. But we change the quality of life, and that's what we do for each other. I can make your life worth living.
So this 97-year-old woman, was she in good physical condition in general, or?
There was quite other things there, but she's now feel good. You know, the main issue which was really adding to what he has was the valve, because it's not a good feeling not to know how to breathe.
Yeah,
sure. It's really, I cannot put myself in the shoes of, I try to, but it's impossible for any human to put himself in the shoes of others. We always claim, but it's really impossible. And we have, I always feel that. You know, I don't know, you know, I have to appreciate when people don't feel good, but I cannot be in their shoes. But I just imagining hard to breathe, and there is no medicine for it. You know, you can't treat. You have to open the valve or change it.
97 years old. That woman has seen a lot of things.
Oh, a lot of experience. I love, you know, because humans, when you live longer, you have tremendous wealth of experience.
Yeah. And knowledge.
And if your brain is okay, if you protect your brain, it's amazing. You know, the problem with our society is people don't protect their brains very well. So when they get a certain age, they go nursing home. But all those elderly people, when you get old and your brain is okay, it's fun to hear their first-hand experience.
Yeah. Okay, our final break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Men like Paul White love Studio Arts and Glass. Why? We wrap all of his gifts. Gifts like hand-blown paperweights, ornaments, jewelry in stunning sterling silver and precious stones like amethyst and crystals. After 30 years, Studio Arts and Glass is known for creating and restoring stunning stained glass. Just ask Paul White. Studio Arts and Glass on Apple Grove and 77 in North Canton.
If you're worried about the flu and other viruses running around this winter, you need to check out our antiviral and antibacterial products we have in our Medicine Center pharmacies. We have hand sanitizer sprays for countertops, door handles, wipes, face masks, and many other items to help you stay well. It's also not too late to get a flu shot, as well as other immunizations. Plus, don't forget to take a daily multiple vitamin. Our pharmacists recommend Linus Pauling Super Multivitamins, so stop into Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia.
You're listening to Health Matters, and let's get back to Dr. Sabe.
All right, Dr. Sabe, how about we talk about the transcatheter aortic valve replacement procedure? We understand Mercy Medical Center was the first hospital in Stark County to offer TAVR. How long has TAVR been around, and when did Mercy first begin offering this minimally invasive procedure?
Well, the procedure has been around for quite a while because the French doctor did it 2002, I believe. And then studies starts to do. And actually, early, I was here, and I remember because I've been working with a valve since my first valvoplasty was 1988. So they got the doctors who use valves to be in the studies. So, and I went to the planning committees and stuff, and we were going to have this done years ago at Mercy, but unfortunately at that time they require a biplane lab, actually hybrid cath lab, hybrid. It's a cath. It's a certain technology when you have the cath lab big enough that if something bad happens, they can crack the chest open on the spot and do it. And we did not get this in our hospital with the limited resources fast enough, so I was not part of the studies. So I had to wait until the valve is approved so I can use it, which was like 5-6 years ago or so I started using. So, and it's a technology, we had to use it because it's not fair not to offer to our elderly patients who can do maybe poorly or okay with surgery while this valve can be done easily. And the procedure was done in a very, very well-controlled way. So the users, every time you use it, even up north in the clinic, when they were using it, there was a company will send somebody from Europe who has quite experience. So that we have... When we started doing it, there was always somebody with a lot of experience around. So they want a perfection almost. And that's how it started. And I was lucky enough because early in our experience, one of the proctor was from Germany. Okay. And in Europe, they were started to do it without general anesthesia, without putting the tube in.
Wow.
So I said, that's great, and I heard about it. Can I do it here? He said, go ahead, I'm here. And so I started doing it without general anesthesia. And I think I was one of the very early in this nation. And we loved it because the patient comes, just a conscious sedation. And, doing, I don't advise anybody like to jump into this. I didn't jump uncalculated because I have so many years experience. I do every year 1,000 procedure. I shared with you. Last year was 1,050 procedure inside the heart. So for so many years, I work in the lab. Hopefully, I know my way. With the help of God, we did it on conscious sedation, and we loved it because we start sending patients same day home. What is that? I said, well, you didn't have any complication when you did the procedure. The groin is okay. End of the day, and people loved it. Some patients say, the family say, can we stay overnight? I said, yeah, it's all right. But it was so early in our experience to send the patient to home, so I did something. I said, if I send them home, at least visit me in a clinic at MCI next week. So I want to be sure. And it was all right. So we said, okay, we'll do it. This 97... in my opinion, she was okay that night. She could go home, but we kept her overnight. So she went home next morning with a new valve. And that was, by all criteria, that's far more than you. I'm not, when I do things like the chest pain center when I did it at Mercy, I was not competing with anybody. I thought this is the right thing. Nobody ever opened an artery inside the emergency room. Why are you doing this? I said, because that's the right thing. I need to stop the heart attack in the emergency room. And I have enough good people at this institution. Mercy is such a wealth of, I think it's the sisters. I'm so grateful to them. They build some community of ethicals. There is people who love to serve the kids of God. Because every patient come to us, there is a father who see what are we doing for his sick kid. And we serve the father. So this was amazing. So that's how we started, and then we fly with it. And I was showing the statistics. Actually, we were showing, we have meeting to our group, and a physician executive from the clinic was here, and I show my data, and he was looking at it. I said, it has to be the prayers of the sisters. Our valve results is unparalleled. People go home fast, and we are yet to have complication or even major or minor. People are doing great. And every time the company said, that's cannot be just it has to be luck. Well, luck will not stay for 5-6 years. It has to be divine intervention. But it's really true. People experience is amazing.
We're running out of time here, Doctor. You have to come back. We only got through half the schedule.
That's okay.
You're having some events for American Heart Month. Well, I know there's a cooking demonstration.
Good. Yeah. Why don't you?
And you can call Mercy Hospital Register. How about that? Does that sound good?
It sounds great.
All right.
Okay. Thank you very much for coming today, Doctor.
You're very welcome.
Sorry we didn't have more time. So,
okay.
Dr. Ahmed Sabi, Executive Director, Mercy Heart Center. We'd like to remind our listeners, if you suspect you have a medical condition, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and, of course, our technical producer, J.D. DeAngelis. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again next Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.